Rises with The Boca Show. Sundays at 4, only on 1470 WNN.
If you're sick and tired of being sick and tired, tune in to the Dr. Bob Martin Show. From erectile dysfunction to eczema, heartburn to headaches, carpal tunnel to how to lower cholesterol drug-free. Sunday mornings at 10 on Talk 1470 WNN.
If you suffer with diabetes, there's a 25% chance that you'll develop a foot ulcer that can lead to severe health consequences, including amputation. At the sole authority, at little or no cost, you can receive your very own therapeutic shoes and custom inserts. Medicare recipients are entitled to 1 pair of quality diabetic shoes and 3 custom inserts. Call the Sole Authority today, 954-597-7060.
Talk health. Talk wealth. Talk politics. Talk 1470 WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Medicine continues to change every day, and the doctors responsible for this are now doing what they can to share this information and news. Introducing Regenerative Medicine with Dr. Escobar, a new approach to pain management here in Florida. Dr. Escobar is board certified by the American Board of Anesthesiology, the American Board of Pain Medicine, and diplomat of the American Academy of Pain Management. He has been practicing in the area for over 15 years. He has lectured in the community as well as mass media on various topics in pain management. As a leading provider of interventional pain management in Aventura, Pembroke Pines, and Hollywood, Dr. Escobar works hard at treating the source of your pain with the goal of restoring you to full function in your normal life and activities. If you wish to join the conversation or have a question, please call 888-565-1470 and talk with Dr. Escobar. Now, here is Dr. Escobar and today's show.
Hello. Welcome back to station 1470 AM on your dial. Welcome back to the Regenerative Medicine Show with Dr. Luis Escobar. How are you this week?
I'm very good. How are you doing, Tracy?
Just great. Dr. Luis Escobar is the sole practitioner at Pain Care Specialists of Florida. Es el doctor de los milagros. I'm Tracy Cowa, your host. Dr. Escobar is a double board-certified doctor of anesthesiology and pain management. His practice is dedicated to interventional pain management. He has 3 offices in Hollywood, Aventura, and Pembroke Pines. So last week, we began to unveil the mystery of platelet-rich plasma and stem cell therapy for regeneration and pain treatment. So today, before we get started with Dr. Escobar, I want to talk for a minute to the silent sufferers out there. You or someone you know may be suffering from chronic joint pain, pain in the back, pain in the wrist, pain in the hips. You don't have to go it alone. I want to invite you to join the conversation with the compassionate doctor who cares, the doctor who has done years of research before incorporating PRP and stem cell therapy into his very own practice. Dr. Escobar is your partner in your healthcare journey, helping you step back into your optimum performance and getting you back to your day-to-day activities with freedom and without pain and discomfort. As we speak with Dr. Escobar, remember that you can call in at any time to ask a question or to find out more information, or if you are indeed a candidate for PRP and stem cell therapy at 888-565-1470. Why live in pain? Hi, Dr. Escobar.
Hi, Tracy, again.
So, Dr. Escobar, briefly review from last week what stem cell therapy and PRP is before we get into some other questions that we might have this week.
Yes, PRP refers to platelet-rich plasma. In these are cells that live in our bodies. They have functions. And one of the functions are to regenerate, stop injuries and help regenerate those injuries. We have the capability of regenerate any injury in the body. When an injury happens, a cascade of nutrients growth factors, cytokines are released, and they go to the area of the injury to try to regenerate it. Sometimes these growth factors are not sufficient, not enough platelets that are attracted to the area of the injury. And what we do is we go and get them. We go and harvest those platelets from the patient's own bloodstream, process them, centrifuge them, and separate the bad cells from the good cells. And then once we have the injectate, we precisely go and place those cells at the site of the injury to promote the healing process.
So again, that's using the patient's own stem cells, correct?
Yes, the patient's own platelet-rich plasma. Platelet-rich plasma are not stem cells themselves. There are some circulating stem cells, but the majority of stem cells exist mostly in the bone marrow and adipose tissue in our bodies. They exist in every tissue in the body, but they're more concentrated on those two tissues. Stem cells are pretty much the repairman, if you will. And platelet-rich plasma, the platelets themselves and all the chemicals and growth factors within the platelets are the tools that the stem cells use to proceed with the regeneration of the injured tissue. So if you have a smaller injury, just adding some of the tools that are used for regeneration is sufficient. On a larger injury, the stem cells are necessary, and that's what the difference will be between the stem cells and the platelet-rich plasma. And when you have a larger injury, what we do in our practice is we give a combination. We harvest both the platelet from the patient's own blood and the stem cells from their own tissues, process them, and re-inject it precisely at the site of the injury. And when I say precisely, we actually identify the injured area via fluoroscopy, which is a real-time X-ray, or sonography, which is a real-time ultrasound, and that's how we direct these cells into the injured area to get the best result.
So you're essentially identifying the exact site of the injury?
Absolutely. The first part of the treatment of the patient is identifying the injury itself. Once we have identified the injury and patient has failed more conservative treatments, including physical therapy, anti-inflammatories, rest, sometimes even surgery, and the healing process doesn't proceed adequately, then is when we go in, harvest the cells, and precisely put them in the injured area to regenerate the injury and heal it.
So can you describe the process of stem cell therapy and PRP?
Sure. We get the patient, like I said, we examine the patient, try to arrive to the precise diagnosis. Okay. Once we have the precise diagnosis and patient doesn't have any contraindications for the procedure itself, such as a bleeding disorder or infectious disease that will disqualify the patient for this type of procedure, we proceed to either get the blood first from the own patient, process the blood, separate the platelets. In a different process, we obtain the stem cells from either adipose tissue or from the bone marrow, process them, separate the bad cells from the good cells. Once we have all the cells available, we inject those precisely again into the injured area. This is a same-day procedure. We do this in approximately an hour in our office for the whole procedure.
Dr. Escobar, so this is done in your office. The patient doesn't necessarily have to go to the hospital to have this done. It's all done from start to finish within your office? That
is correct. It's an outpatient office procedure. I'd just like to mention that we do have in our office a laboratory where the cells are actually examined, counted under the microscope, separated, and then is when we have our injectate that we use to put back into the patient's injured tissue.
How fascinating.
There's several important factors when we do this. One of them, like I said, we separate the good and the bad, and the good is not always good and the bad is not always bad. There's certain tissues that respond better to what we call the red cell platelet-rich plasma. What that means is that we leave some of the red cells into the platelet-rich plasma to when we have a muscle injury, and that the red cells are known to help regenerate muscle tissue. When we have a cartilage injury, such as meniscus, then we try to get as many red cells out of the injectate, and we use what is called leukocyte poor and RBC poor platelet-rich plasma. So that's the importance of having an in-house lab where we can actually see the cells, separate the cells, and make it more amenable to the particular injury that we're treating.
Right there on the premises.
Correct.
Without having the cells have to go through any additional processing or transportation.
There is no additional process. It's the patient's own tissues that are processed in the office and then given back to the same patient. It's all autologous.
So you mentioned a few types of conditions that are best treated with stem cell therapy. Can you name a few more for us?
Yes. Any osteoarthritis, so we can treat bone, we can treat tendons, we can treat cartilage in any particular joint in the body. In my practice, we specialize into the musculoskeletal tissue system, which includes the joints in our body, starting from the jaw to the shoulder to the hips to the knee to the wrist, the ankles, and the spine. The spine has many joints. Each vertebra unites with the next vertebra above and below them by two different joints, called the facet joints. And these joints tend to produce a lot of pathology, a lot of pain when there's inflammation of those joints. And these joints respond extremely well to this type of treatment.
Well, thank you, Dr. Escobar. Why live in pain? Call now with your questions for Dr. Escobar or to find out if you're a candidate indeed for stem cell treatment. Call 888-565-1470. Again, to find out if you're a candidate for stem cell treatment, call 888-565-1470. When we return, we have a few questions from last week's show, people who have called in to ask Dr. Escobar a few questions. So we'll get some answers when we return after the break. Again, to find out if you're a candidate for stem cell treatment or to speak with Dr. Escobar, call 888-565-1470.
Get your life back from musculoskeletal injuries faster and without surgery. At Pain Care Specialists of Florida, Dr. Luis Escobar can help you do just that with regenerative treatments of platelet-rich plasma and stem cells. Stem cells live in all of us and act like the repairmen of the body. However, during injuries, we sometimes can't get enough of these critical repair cells to the injured area. This is where Dr. Luis Escobar may help you by harvesting your own stem cells and re-injecting them into the injured area in need of repair. To find out if you are a candidate for regenerative treatments with platelet-rich plasma or stem cells, please contact Dr. Luis Escobar at 954-322-8586 to make an appointment at one of his 3 conveniently located offices in Hollywood, Pembroke Pines, and Aventura. Or visit us on the web, www.painconsults.com. You are listening to Regenerative Medicine with Dr. Escobar. And if you wish to ask a question or participate in the show, call 888-565-1470 and speak to the doctor. Now, back to the show.
Welcome back to 1470 AM on your dial. You're listening to the Regenerative Medicine Show with Dr. Luis Escobar. I'm your host, Tracy Cowa. If you want to see this show live, tune in to AMP2 TV Productions on Facebook and click the live button. So now we're back with Dr. Escobar, and we have some callers who have questions from last week's show. So Jackie from Boca Raton wrote into us, I heard your show last week and wanted to write in and ask, what does bone on bone mean, and how does stem cell therapy work to cure this problem? Or does it?
Well, bone on bone. This is a term used by the orthopedic doctors to refer to the loss of cartilage in a joint. The bone on bone refers that the bones are touching each other. With When you get this diagnosis, I would like to see the patient first and confirm that this is indeed bone on bone, or there's any cartilage. The treatment and the response to treatment will be different if there is some cartilage or not. Will this condition respond to stem cell therapy? It will. It will respond in two ways. One, the growth factors that are released when we do an injection with stem cell and platelet-rich plasma decreases the inflammatory process and decreases the symptoms. In the long run, there may be some regeneration of the cartilage if there's some cartilage left in the knee, and most of the time there is. There is very unlikely the term bone on bone, because when that happens, usually the patient will have a fusion of the bone. There will be like a fracture, if you will. So those bones will fuse together. When that happens, most likely patient will necessitate surgery. But other than that extreme case, I mean, the patient will certainly respond to stem cell treatment with platelet-rich plasma and stem cells.
So perhaps what Jackie's referring to as bone on bone may or may not, in actuality, be bone on bone. It would be according to the examination and the diagnosis to see whether or not any type of this type of situation in her knee would be an ideal candidate for PRP and stem cell therapy.
Yes, like every other patient, and Jackie, I would be happy to examine your x-rays and MRIs if you have, and make the determination and to see how we can help you symptomatically and or otherwise regeneratively.
So, Dr. Escobar, we have a caller on the air. Karen, are you there? We've got somebody.
Hello.
Hi, Karen. How are you today?
I'm very good, thank you. I'm excited to give this call, and I am a patient of Dr. Escobar's.
Awesome. Well, thank you for calling in. We'd love to speak with you.
Well, Dr. Escobar, about a month ago, hi, Dr. Escobar, it's Karen.
Hi, Karen. How are you? Thanks for calling.
Good. About a month ago, Dr. Escobar did do stem cell treatment, the PRP and stem cell treatment, on my left knee. I do have 2 tears in the meniscus from a car accident. And I don't want to go through arthroscopic surgery at this point, very active person. And so a friend of mine is a patient of Dr. Escobar's as well, and had seen the videos and the information about the stem cells, told me about it. So I did make an appointment, and the rest is history. I am feeling so good. The pain that was in that knee is gone. I mean, I really have very little to any pain. I couldn't even walk. Taking a step was like dragging around a really heavy leg.
Incredible.
It's the truth. It really is. It is incredible. It's amazing.
How fantastic is that?
Well, for me, it's great.
Getting back to
I don't want the downtime of surgery, so.
Yeah, and getting back to your daily functioning activities.
Yes, that is so true. I really am. I have to be smart and realize that there are still tears there, and I have to allow time for the stem cells to do their work. But I'm literally taking every step without discomfort.
So basically, you have to let the regeneration catch up to the fact that you're feeling well. So you're constantly reminding yourself. But at least you're pain-free.
Yes, that is correct. So it was a very process was very painless, very easy, very methodical, very professional setting. The staff was wonderful. So I'm just, it was wonderful. It really was. I would highly recommend it.
Thanks for calling in, Karen. We really appreciate that.
Well, thank you. Nice to talk to you.
You too, Karen.
Bye-bye.
Bye now.
Bye, Karen. Very important what she just mentioned. We have to follow the proper body mechanics following the injury, of course, and the regenerative treatment. The symptoms improve faster than the regenerative part takes place. So we don't want to get into a situation that you feel very good, you overdo it, and re-injure yourself.
Right, that's what it sounded like. She was reminding
Right.
herself
So,
to take it easy, slow down a little.
That's very, very important. And of course, therapy, physical therapy is always a good component of the overall recovery treatment.
Well, it's funny that you mentioned that because we had another question. Nancy from Aventura wrote in last time after our last show, and she wanted to know, how long does stem cell therapy take to cure an ACL injury, and does this procedure require physical therapy after the treatment?
Okay, that's a very good question. Actually, several questions. How long does it take? First of all, we have to determine whether a patient is a good candidate for the procedure itself. At this point, a complete tear of the ACL has been treated with good results, but it's not the standard of care. Okay, partial tears are more of the standard of care, and they do recover quite well with this mode of treatment. The recovery time could be anywhere. Again, the symptoms improve a lot faster than the regeneration. The regenerative part would take anywhere from 4 to 6 months for that to completely take place. So we have to, even though the patient will feel a lot better, it will take that much to actually regenerate and be without any fear or any re-injury. And therapy is definitely a huge component on the recovery part, together with the proper body mechanics to prevent further injury.
Right, and I would think also the physical therapy would help to not only strengthen the area, but help guide the patient in how to move so that they're not overdoing it.
Yes, that's what I would refer when I mentioned the proper body mechanics. That's part of going to physical therapy is not just doing exercises, is the teaching from the therapist to how to do things, how to prevent more injuries to the area that you're trying to protect. At this point, I would like to also add that there's other components, not just physical therapy. We mentioned on the previous show that we have to optimize our host to the cells that are coming into the regenerative area. In very simple things that we can do is, if you smoke, you should quit smoking, because if there's not enough oxygen, you're not going to regenerate properly, with or without stem cells. We have to get into a good physical shape, very healthy, proper diets. And together with this, we have to have a good lifestyle, sleep well, eat well, exercise well.
That's why you're the compassionate doctor who cares.
Well, we have to cover all the areas. You know, in the more ingredients we put into the soup, the better the soup that we're going to have at the end of the day.
Right, and the quicker the healing process, I would think, the better shape you go into the therapies.
For sure.
Then the more quickly you'll heal and regenerate.
Yes, ma'am. Yes.
And it's a great excuse to stop smoking. Stem cell therapy.
It's like I tell my patients, that injury is not going to kill you. The smoking will.
Right, exactly. You hear that?
So
the
yes,
injury is not going to kill you, but the smoking will.
So we definitely want to improve the whole overall health in the environment where our cells are going to go and be working to regenerate the injuries.
Got it. So I think we have time for one more quick question from Bobby from Fort Lauderdale, who asked if he had surgery on his knee. He had a bad meniscus, and the pain and swelling in the knee doesn't go down. After the surgery, would stem cell be something that would help him overcome the pain?
In the short answer will be yes. The long answer will be we have to examine the patient, check the x-rays, check the MRI. If there's any swelling, is there any loose fragments? Why is there still a lot of swelling, and how long after the surgery? If this is just a reaction to the surgery itself, absolutely we can have very good results to both the pain and the swelling involved on a post-surgical patient. Stem cells are very helpful, as we discussed in the previous show, the pre-operatively, intraoperatively, post-operatively, and instead of operative procedures. So
Well, thank you, Dr. Escobar. And there you have your answer, Bobby. Thank you to all of our callers. Thank you to Karen. Thank you to Jackie, Bobby, and Nancy for sending us your questions. So thanks again for tuning in to the Regenerative Medicine Show, 1470 AM on your dial. Again, if you want to see this show live, go to AMP2 TV Productions on Facebook and click the live button. Next week, we'll be talking with Dr. Escobar about conditions that he's been treating and getting some great results with using the PRP and stem cell therapy. Any last thing to add, Dr. Escobar, today?
Well, I would like to invite your listeners, your million of listeners, to contact the office if they're in need of any treatments, patients in pain, patients that have had injuries that want to avoid surgery, any patient with shoulder, knees, hips injuries that have been recommended surgery. They owe it to themselves to first try some stem cell therapy to try to regenerate the injuries and to avoid surgery. It will be a much faster recovery and less painful recovery for sure.
Awesome. Again, why live in pain? Let Dr. Escobar do some PRP and stem cell therapy to help you regenerate those joints in your body to get you out of pain. Call now to find out if you're a candidate for stem cell treatment. Call Dr. Escobar's offices at 954-322-8586. Again, call Dr. Escobar at one of his 3 locations. The main line is 954-322-8586. Thank you for joining us on the Regenerative Medicine Show with Dr. Luis Escobar.
You have been listening to Regenerative Medicine with Dr. Escobar. Join us every week for more information and news on achieving full function in your normal life and normal activities. Call Dr. Escobar for more information at 954-322-8586. See you next week on Regenerative Medicine with Dr. Escobar. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.